So the first group we're going to talk about are tricyclic antidepressants, which are commonly known as TCAs. This is the oldest group of antidepressant medications. All of the TCAs have a three-ring chemical structure, and that's illustrated in your textbook. They all have similar effects and therefore similar side effects. Now, there are what we call two generations. There's some older um, TCAs and some newer TCAs, and I'll talk a little bit more about that in just a minute. Now, tricyclics are used in the treatment of depression, but they also have some additional uses, including obsessive compulsive disorder, which was talked about in the last chapter, and then enuresis. So enuresis is bedwetting, also known as nocturia. So here is the mechanism of action for a TCA. So this is illustrated in your textbook as well. So how TCAs work, they're non-specific blockade of the reuptake of monoamine transmitters. So the monoamine transmitters include your norepinephrine and your serotonin. So these are monoamines. So it's going to stop or block the reuptake. So here we have those blockades. Whoops, go back. Oh. So these are our receptor blockers. And here we are blockading the reuptake piece. So TCAs, don't let them be taken back up. It also will block the access for the histamine. So we see that that H would fit right down in there, and also block the other neurotransmitters, the cholinergic and muscarinic receptors. So these are blocked. So the only ones left available in this competitive environment is the serotonin, which can come in here, or the norepinephrine, which can come in here. So this is our NE, and this is our 5-HT. So the block of the reuptake of the norepinephrine and the serotonin in the presynaptic neuron and the postsynaptic receptors, the longer those neurotransmitters are in that cleft, the more chances they have for those happy hits into those receptors. The TCAs keep the monoamine transmitters available for binding for longer periods of time, thereby increasing the opportunity for those binding receptors. So just like I said, it leaves them there and it allows for more happy hits. All right, the side effects with TCAs, now they all have similar structures and therefore they all have similar adverse actions. So dry mouth, urinary retention and constipation, and blurred vision. Now, these side effects are also known as anticholinergic side effects. So if we go back to the previous slide, we see that we are blocking those cholinergic receptors. So by blocking those, we have anticholinergic side effects. So there are a set of side effects that are pretty consistent, and I'll mention those many, many times throughout the entire course of pharmacology. So when I say anticholinergic, you want to think dry mouth, urinary retention, constipation, and blurred vision. Okay, here's a little note. You should write that down. It's important to remember. Additional side effects with TCAs include hypotension and arrhythmia. They do have some drowsiness to them, so they can cause some sedation. That histamine blockade Like an antihistamine like Benadryl can make you sleepy. Well, because we have that histamine blockade, here we've got that histamine blockade, it can cause that kind of effect. So sedation, and also it can cause weight gain and hypotension. The blockade, so sleepiness, take at night. All right. So the warning labels. So those were the side effects. So if they make you drowsy, well, or sleepy, cause sedation, we want to tell the patient that it could make them drowsy. And of course, alcohol could make that effect even more intense. And because they make you drowsy, they could impair your ability to drive. Patients should not discontinue TCAs without supervision by their physician. Also, TCAs cause what we call photosensitivity. So photosensitivity can cause hypersensitivity, rashes, and intolerance to heat when of prolonged exposure to sunlight. And also something unique to the TCAs is they make discolor urine and cause them to be a blue-green color. So it's important that your patients are aware of that. We don't want them freaking out when they pee blue. All right, so your TCAs. Let's talk about the drugs. Before we do, let's talk about drug stems. So like I just said, there are two different groups or generations of tricyclic antidepressants. We have the older tricyclic antidepressants and the newer ones. The older ones have a drug stem of triptyline, and the newer ones have a drug stem of mipramine. All right, so your TCAs. Amitriptyline, which is Elavil, and I have a photo of a label and the different strengths of Elavil. Clomipramine, so that's one of the newer ones that ends in mipramine. That's an Anafranil. That was in the previous chapter. Desipramine, which is norpramine, and doxepin, which is Sinequin. So doxepin is one of those, it doesn't fit with the triptylines or the mipramines. There's also imipramine, which is tofranil, nortriptyline, which is Aventil or Pamelor, protriptyline, which is Vivactyl, and trimipramine, which is Sermontal. Now, another little note for you on the imipramine, especially, imipramine is one of the drugs that's used for anuria, for nocturia, for bedwetting. And it's approved for children as young as 6 years old to treat bedwetting. All right, now our sound-alike lookalikes. So clomipramine could sound like chlorpromazine or clomiphene. Desmipramine and imipramine and desipramine and triimipramine, they all kind of sound together similar. Then there's another drug called triamterene, which is actually a diuretic drug, and then nortriptyline and amitriptyline. So spelling, we've got to be careful. They look alike, they sound alike, and that potentially is a challenge. Now, on this list, not all of these drugs, these are not, digoxin is not, and triamterene is not. These are not your TCAs, but they're other drugs. Now, doxepin and digoxin is actually a drug used in heart failure. So we definitely don't want to get those two mixed up.